Welcome to the Love Podcast. Today we are going to have Dr. Asia Standifer with us today, and she is going to be discussing with us our lovely topic of becoming a healthier you. So let's welcome Dr. Asia Standifer to the show.
Thank you so much
Doc-
for having me. Super excited.
Absolutely. We are super excited to have you. As we've been going over this series of just becoming healthier mentally and both physically, I thought it would be great to bring on you to just kind of go over like your experience, what you've seen as well, being a nurse practitioner and having your medical weight loss clinic as well, and just kind of go over the things that you've seen, just some things that maybe we can work on better at home,
Yeah.
also the misconceptions about the medical weight loss that have been going around. I know you've been seeing a lot about things in the news
Mhm.
and things like that, just to get your perspective. So definitely, if you want to go ahead and just introduce yourself again to our audience, just let them know a little bit more about you and how you got started in healthcare.
Yeah, absolutely. My name is Asia Standifer. I'm a doctorally prepared nurse practitioner. So, formally, I am Dr. Asia Standifer. By training, I work internal medicine and neurocritical care. It's things I have passions about. I'm from Polk County, born and raised my whole life. I'm a Mulberry girl, something I'm very proud of. I kind of take the lessons I learned from being a country girl. I take that into medicine. I think that allows me to connect with a lot of people. I also own a weight loss practice. In addition, that I mix in with some internal medicine and wellness things. It's called Polk Conceirge Medical. I'm located in South Lakeland, and I am thrilled to have the opportunity to serve my community in these capacities. So yeah, I'm super excited to talk about these topics. So let's get into it.
Yes. So when we talk about becoming a healthier you, what does that mean to you? What was your journey? And I know you have a journey as well in becoming healthier yourself. So
Mhm.
what does that mean for you, and how did that look for you becoming a healthier you?
Yeah, goodness. My journey really started out, I guess, young in the sense that I had a lot of family members who had complications, medical complications from things that we kind of think are everyday issues: high blood pressure, high blood sugar. And so I saw early on what these things could do to your overall well being. However, I did find myself falling into some of those health issues. I was on blood pressure medication. I am of short stature. I found myself to be clinically morbidly obese, and that came to a point where I was like, either I'm going to make a choice to do better, or I'm going to become one of my own ICU patients. And when I had that very real conversation with myself, is when I decided I got to turn things around. And I did. And so I have lost 54 pounds. I'm off blood pressure medication. I became dedicated to being a healthier me because I needed to do it for myself, for my family. And I
Absolutely.
need to be an example to the people I care for. So yeah, that was my journey. It was not simple, but I had to make a decision to do better. And once I did, it was game over from there. I had to do better, and I've done better. So I'm proud to be able to help guide other people into doing better themselves.
Absolutely. And when you say that your journey as far as like doing better, what were some of the things that you implemented into
Ooh,
Yes, let's get into that. Let's get into that. What were some of the things you had to give up? What were the struggles, and what were some of your wins, the gains from
yeah.
doing that?
Um, okay, so we're gonna have real conversations. So let's start with the fact that I had to personally, because see, this is gonna be real. And
Yeah.
this is where people, when I have this conversation with people, they're like, oh, okay. I had to address my relationship with food. I
Yes.
had to figure out, why did I overeat? What was that about? Why do I have no willpower? Why do I make these decisions despite ending up on blood pressure medication, blood sugars not looking ideal, cholesterol going up? Why do I choose to continue these habits in spite of knowing these things and working in healthcare? That's when you get real with yourself and you realize, like, I have a poor relationship with food. I identified that I didn't know how to tell myself no, and that I was really doing myself a disservice by doing whatever I wanted with my body and my eating habits. Once
Yeah.
I acknowledged those things, and actually I realized that a lot of these habits I developed in childhood. These were habits I developed in childhood that I carry with me into adulthood that led me into the health situation I was in. Once I acknowledged those things and I held that mirror up to myself, I was like, okay, well, now how do we undo this? And it was really a building block at a time. And I share this with my clients all the time. It was really just one meal at a time saying, Asia, no. Asia, make a better decision. Once I got to a place where I could make these decisions without hesitation, I really celebrated every single thing I did. So I tell people, okay, well, today you chose, to eat salad, whatever, whatever, over this, celebrate that win. Because those of us who have had weight issues, we know it would have been much easier to drive over to Popeyes. It would have been much easier to go ahead and order this DoorDash and let that be that
Yes.
versus me trying to figure out how I'm going to meal prep for the week. Because let's keep it real, it's difficult. We're
It
busy.
is.
We have all these reasons. But when I tell you, when you have the conversation about how hard life can be with comorbidities that will take you out of here into an early grave, I tell people things are hard. Changing your lifestyle is hard. Eating healthy is hard. Making those decisions is hard. But you have to choose your heart in this life. Because you know what else is hard? Dialysis every week, being on blood
Yes.
pressure medications for life, having to have considered transplants. Which heart do you want? Do you want the hard on the front end where you make healthier choices, have to make decisions and tell yourself no? Or do you want the hard that puts you at DeVita dialysis 3 days a week? Pick your hard. And
Pick
when
your
I
heart.
had that conversation with myself, I'm like, I'm going to choose this salad. Thank you. That was that. Appreciate. Thank you so very much. I'm going to choose this one to the left. Thank you. Yeah.
Absolutely.
Hmm.
Yes. You are hitting it so on the head because it's so much mental when it comes to food, and we don't realize how
Yes.
much like it's emotional
Hmm.
for. I know for me, I'm an emotional eater. When
Yes.
I stress, the first thing I want is, okay, where are the cookies? Something sweet. Where's
Hmm.
the cake? Something chips. I need something. I just need something to munch on.
Yes.
It settles my brain down. Now I'm
Yes.
good. And so people, I love that you brought that. People really don't realize that their relationship with food is like majority of their battle almost is just mentally getting into
It
that space
is.
of what do I want more? Do I want my life or do I want this
Mm.
red velvet cake today?
Talk about it. Yes. Yes. And that's the thing. And then we don't, and I will say this, if we go back to, let's take it back culturally. Food is
Yes,
how we show love because in the early days, that's all we had. We didn't
yes,
have extra. We didn't have, so food and preparing these very rich foods is how we show love to people. So it starts from there. And so
yeah,
what happens when someone is sick? You take them food. When
yep.
someone passes, what do you do for the family? You take
Take
them
them food.
food. And it's the good stuff. And so sometimes when you start denying your things that have brought you comfort, you feel as if you're doing yourself a disservice. And then what
Hmm.
that really boils down to, if we want to get down to it, is lack of coping mechanisms.
Yes,
Because we've learned to then cope with things and stressors with food. And so we didn't build those other things to help us get through our stressful days or whatever may be happening because throughout our entire life, when something went wrong, we brought food.
we brought food.
So, yeah, we
That is a
brought
real
food.
thing. That is a
Hmm.
real thing. And I love how you said the culturally because it is. And you can see that in different cultures how their health is a little different than ours,
Hmm.
as far as the way they handle things. Because like you said, culturally that is something that we tend to do. We rely on food. That is part of us. But we have to make smarter choices because we are
We
also
do.
the ones that are at the top of the tier for like the heart disease and things like that you know
Absolutely.
um so in that too with it being a cultural thing, is there do you think there's a way that we can dial back or things that we can do to maybe change those ways that we're thinking like the I know my our grandmothers have their certain ways of doing things, but what are the things we can do to try to change that stigma and change that way of thinking that we have to rely on this food. I know my dad is one of those people. I've tried numerous times to be like, hey, how about you get an air fryer? let's stay away from the pan and the grease. Let's get an air fryer. And he is just one of them that's like a bull. No,
Hmm.
that's that. I'm not doing that. I was raised old school. We fry in the frying pan. It's like, so what do you find? What would you try to maybe see about implementing, to help
Yeah.
some of our younger generation kind of get away from some of the things that our older generation has instilled in
Yes.
us?
So what I tend to recommend, especially in my post-surgical patients and working in neurological critical care, we see so many devastating strokes. We see so many devastating situations and diagnoses that require surgical intervention. And so what I do with I lovingly care for my African American community. So what I recommend is, okay, we like greens. Must we put
Hmm.
fat back in lard? Must we do ham hocks? Can we do smoked turkey? Can we do smoked turkey seasoning? So low sodium is where I start because we have to make incremental changes. And so when you're trying to break habits that have been instilled in for decades, you have to start small. So incremental. So how can we modify what we love to transition to something that's a smidge healthier? So that air fryer is a very, very good idea. So air fryer. So what you would do is if it's someone in your family, you prepare it for them. And you just give it to them. And you say you put your fish, chicken, whatever in the air fryer and you give it to them and they talk about how much they loved it. And you say, well, I cooked that in the air fryer, and then you pique their interest. Also, those things that, like I said, substitutions, seasonings that are lower in sodium, because you have to show them and guide them. So you have to show them, like, hey, these are low sodium options that are good. These are sauces and things that you can find at Publix and Walmart that don't have as much sugar. So it's really about modifications. It's really about small modifications so that you can then show them, like, hey, this isn't as bad as you may think. And they're usually surprised. But small modifications starting out.
That makes sense. Yeah. I mean, it's just the issue of trying to get him to try it because I know he's going to be like, well, you got an air fryer at the house. So you probably air fried this, but you are right. I'm going to have to figure out ways to kind of maybe trick
Yeah.
them a little bit.
That's it. That's
So,
where it starts. That's where it
yeah.
starts. Because when I tell you those things are so ingrained, and so and it's the old saying, you can't teach an old dog new tricks. It does
Yep.
ring true to some degree. I'm telling you, but you can try. You can try. Good luck, but you can try.
You already know this is a Polk County man to his heart.
I know all too well. Good luck.
So I'm like,
All
okay,
right.
pray for me. Pray for me.
Good luck and
Um,
good night.
yes, yes. So what are some of the things, I know we talked about some mental impacts that we have,
Hmm.
stress. Um, what are some other things that you think also kind of cause that other issue with as far as like our weight, like we can't seem to lose the weight or we continue to gain the weight? What are some other things that you've seen in the medical field that maybe attribute to that as
Yeah.
well? That maybe
So
we
there are a
can't
few things.
personally handle, but
Yeah, there are a few things. I really start with hormonal imbalances or what I call hormonal events. There are things that can happen in various times of your life that can cause hormonal changes, whether it be childbirth, development of things like PCOS or thyroid conditions. Those really impede weight loss. And so some people don't realize they have some of these conditions until they get particular labs. And then it says, well, you have a underacting thyroid, so your thyroid is moving a little slower. You have a metabolic syndrome, you have polycystic ovarian syndrome. These are all metabolic or endocrine issues that make weight loss more difficult. So sometimes the first symptom of these things is, man, I have gained this weight, and 5 years ago I could drop it and now I can't.
hmm.
Another thing is, besides the way we eat, is on all too often we don't get regular health care. We don't.
Yeah.
And then that goes into a whole systemic issue. Is it access to care issue? That is a big issue in rural areas, including Polk County. You can't get to a primary care provider for 6, 7 months because they're backed up. So there's delays in seeking care simply because the care is not accessible. I can't tell you. I'm currently at about 250 clients, and I have a background in internal medicine as well, and I am bridging the care of people. Um, in between them being able to get a new provider, and they're moving down here. So I do provide referrals for some providers here in Polk County that I absolutely adore. They're amazing, they're thorough, but their appointment, they can't get an appointment for 6 months. So I'm bridging their care. So sometimes it's just access issues, underinsured or not insured at all. sometimes it's a lack of healthcare literacy. And then since this whole day is going to be about real conversations,
Yep.
Black people don't like skinny or what we
Yeah.
call skinny. So culturally, they'll be like, someone who like me, 5'2", I started hitting 160 pounds and people were like, don't you lose no more weight. That's not going to look right. Well, hold on. I'm still taking amlodipine every day.
Yep.
So we need to stop doing it to each other
Yes.
because we will quickly be like, girl, or or your grandma tell you, you're like, well, hold on, because my cholesterol is still over 200. So it right. So some of that is we will do it to ourselves because culturally, or thick girl. You want to be that thick girl. You want to be okay. You may be thick, but what is your heart looking like? The other
Yeah.
side of this rings true too. Just because you are considered overweight by a traditional American scale, what do your labs look like? Is your heart doing okay? Are your vessels clean? Do your endocrine system look good? Is your liver good? Well, then you know what? We need to also be mindful that just because someone may have some extra pounds does not automatically equate unhealthy. So there's a couple of things.
Yes.
There's a couple of things.
Definitely. And you know what, Asia, you hit something on the head because that was going to be one of my other questions about the challenges with healthcare that you see. And definitely, like in our community, like you said, it is hard to get access to good healthcare. I know with me, I suffer from that as well. Sometimes it takes me at least like a month or so to get in
Hmm.
to see my primary care physician, and it's
Yeah,
just, it's crazy to me that it takes that long to see a doctor
it
because what
does.
if you are dealing with something that's more, urgent? You can't even
Hmm.
see your primary for almost a month, and that month could make a difference, correct? Like, that
One
time
hundred
frame.
percent, 100%. Because a lot of times we have these very what we feel are benign symptoms, but by the time you can actually see somebody, it's turned into something. Next thing oh, I have a headache. I'm going to see somebody. I'm gonna schedule an appointment. Well, next thing you know, your appointment is 6 to 8 weeks later. You get there, your blood pressure is 174 over 113. And so that blood pressure has just been creeping up the entire time, or other things. So that becomes a difficult issue. And then the access to care issue is medically systemic problem. It's an ongoing issue trying to
Yeah.
get people to, more providers interested in primary care to help alleviate some of these things. I think from the Florida state legislation has done a really good job at trying to improve access to care by providing nurse practitioners autonomous practice within the family practice and internal medicine settings, which allows me to practice freely. I am a nurse
Yeah.
practitioner. I have an autonomous practice license, so I'm able to provide care to my community without needing MD supervision. That is helping move Florida along in providing access in rural areas, underserved areas, and things like that. The laws surrounding telemedicine have been extended so that it provides additional access to care. It makes it easier for people to see a provider sooner than later. Florida legislation is moving things along. We have a long way to go when it comes to allowing nurse practitioners to practice fully in their scope of practice, but laws are starting to move. So that's going to help alleviate some of those issues. But from another standpoint, we also have to take personal accountability for our own health. Get your labs done, if nothing else. Get your blood pressure done. I really pride myself in being a full service provider. You can come get your labs done, get your blood pressure checked. We can do all that for about $60. One way or
And
another, we all got 60.
we
So
do.
come in, get that done. Because you know what? Since I mentioned Popeyes earlier, how about we don't go to Popeyes for a couple times? Because Popeyes is high. sit,
Right.
sit that aside.
Yeah.
Come see me. Let's get your labs. Let's talk about it. Because we go over your labs, we review it. And then if you need any prescriptions or anything like that, vitamin D supplements, maybe something to help with your blood pressure while you're working on your weight, I provide all of that too. So we just have to also take responsibility and just be like, you know what? Let me do a little better. And the new year is coming up, perfect time to do that. But I tell you,
Yes.
we have so many barriers to healthcare, you can't even tackle them all. Like we could have a whole 2 hour conversation about just the barriers in the healthcare in the Black and Brown community. But we
Yes,
all got to do our part. Yeah, we
we
all got to
do.
do our part.
That is so true. And you are so right. We have to take accountability because yes, I mean we can you spend $60. I know most black women do at least in your hair. If
Talk
not
about it.
anything else. So you definitely have it, and like you said, it's all about
Hmm.
taking accountability and what's the priority at the time. And I think a
Yes.
lot of people, even to touch on something else, is just like Black people don't like going to the doctor, period. Because there's also a stigma I've heard of where we don't trust the medical professionals, some
Mm.
of them,
Let's talk
there's that
about it.
stigma.
Let's talk about that. Let's talk about
Yes.
that because let's talk about how that belief and that feeling is rooted in 100% absolute truth. And when I
Hmm.
say, so I work at a local hospital, large hospital, and I think one thing let's say this statistic first. In neuroscience, less than 2% are Black, and less than 1% are Black women working in
Hmm.
neuroscience. So, one thing I believe I bring to my service is I bring cultural awareness. And so, I like to always say, and when it's like, well, how come this person didn't go to the doctor? Or why don't they take their medication? Or why I'm having a conversation with this and I feel like, they don't hear me or they don't trust me. I always start the conversation with, have you ever heard of the Tuskegee experiment? Henrietta
Yep.
Lacks. Let's
Yep.
start there because until we understand that that is the foundation in which Black people have their belief in healthcare built on, you will never
Hmm.
understand where the medical mistrust come from. I keep
Yes.
that at the forefront of my service because you need to go into these conversations understanding that this is a very real thing and it's based on truth and fact. Black people historically were experimented on and toyed around with. So from that, there can be this mistrust. So you have to understand how you handle this culture of people.
Yes.
You can't, and even if you want to add another layer, Southern Black people. Like you're not gonna just walk in to Miss Sam's room and say, and call her by her first name and say, Sam, hey, what we're gonna do this morning is that's not gonna work. You're not gonna tell Miss Sam how she gonna run her husband's healthcare. Come in there with some respect. Good
Yes.
morning, Miss Sam. How are you feeling? How you doing? How's your husband doing this morning? Be mindful of how you approach these people. So let's
Yes.
start there. So the medical mistrust is real. And I think what we need to do, and as healthcare providers, we have to be mindful of is A, when you walk in the room, stop going in there with medical jargon. No one cares about that. We know you're smart. We know you went to someone's medical school, someone's nurse practitioner. Got it. Next. Speak in plain language. People are intimidated sometimes by going to the doctor because they're like, oh my gosh, what is this person gonna say? I don't even know
Hmm.
know what they're talking about. Are they
Yep.
just gonna tell me I'm fat? Are they just gonna tell me that? So you go into a visit like, here we go, it's gonna be this mess again, versus
Hmm.
it being a conversation, understanding the barriers, or versus like, have you started taking your blood pressure medication yet? Address it differently. How can I help you take your blood pressure medication more often? Is there anything I can help you with? Is there a cost issue? We have to start treating people, and this is where I put it on the medical professionals. We got to start treating people like people because
Yes.
that becomes one of the barriers to people wanting to walk through your doors and seek care because they don't want judgment. They don't want to feel like I don't understand what's going on because this person talks over my head. And I don't feel like you're just going to bash me because, I haven't been doing what I need to be doing, but I'm here. We need to acknowledge that a little more and do better when we have these visits with people. But that's what keeps a lot of people from going through the doors too, is they just don't want to feel all the negative stuff that can come when sometimes they're made to feel less than.
Yeah. It's the judgment. And the
Mm-hmm.
bedside manner. I'm so glad you touched on that.
Mm-hmm.
The bedside manner sometimes is so like, I'm like, like really, like I came here for help and I feel like I'm being scolded,
Yes,
and judged. And it's like, okay, but I'm coming to you for this reason because I want help. So it's like,
exactly.
but you get in there and like you said, sometimes the words it's like medical jargon and you're like, okay, I'm not the medical professional. This is why I'm coming to you. So I need it broken down into English. Like, yes, maybe I could go to WebMD. I'm one of those resourceful people. But
However, since you're going to bill my insurance anyway, how about you put in a little work and tell me what this means?
exactly. And it's crazy to me. And like I've had a doctor like that I had to switch because it's like I come in, it's like, well,
Yeah,
you're overweight. Like you said, the first thing is like, well, I know why you have high blood pressure. You're overweight, and it's like you're obese. And I'm like, you hear those words, and they're very triggering. Obese, overweight, and
very.
it already makes you feel like less than. So it's like, you don't even want to like try anymore. It's like, okay, well, I'm fat, and
You
okay,
right. And you're
and
just
and it
like,
just
yeah,
yeah, and it just messes with your self esteem. And then, like, kind of like you said, my ear turns off a little bit because, like, now I'm in my feelings and I'm not as
mm-hmm,
receptive to whatever you're getting ready to say now because I'm having that emotional moment because you just said trigger
Exactly.
words to me that if you had said them differently, like you said, I'd be more open to be like, okay, well, how can I, change this instead of being like, well, okay,
Exactly.
yeah, I'm fat, great, So that is
Yeah.
so important, and I think no people really don't talk about this, and I
Mm-mm.
know for me, like I tell my husband all the time, like I can't stand rude people, period, in any
Whew.
profession. Like
Mm-hmm.
I hate, I won't say hate, I strongly dislike people that just don't seem to have any kind of customer service or just any like just tact about themselves so they
Right.
can just speak to somebody like a normal human being, like you said. Just I'm a human being just like you. That's
Mm-hmm.
all I need you to treat me as. Like if I'm coming in saying good
Yeah.
morning, please say good morning back. Like
Right.
address me as
There
such.
has to be a level of mutual respect that goes both ways. And even being, I've had my own situations in just like going through some of my GYN issues where I had a provider and I had to respectfully and politely put her in her place and remind her that at the end of the day, you know, how did I say it? I don't even know if it came off this nicely, but it was it was like nonetheless be mindful that I this business exists because of people like myself who come to seek your service. So be mindful of the way that you treat others and be respectful of my time in some fashion of that nature. Because I
Yes,
was not having it. I was not having it. So I've experienced it. And so I know what keeps people from going to the doctor's office. I know what keeps people from getting care because the hardest thing is admitting you need help with something. And to
absolutely.
think you've mustered up the strength to say, you know what, I'm going to go look into this. And then you get there and then you feel demeaned. This is why
Hmm.
people don't show up. And so, as healthcare providers, and especially those serving minority communities, we have to continue to be mindful of how we treat others. But then, when you find that person who speaks to your experience, who makes you feel accepted and seen and heard, share like, oh, this primary care doctor over there is great. This nurse practitioner is good. We have to be better also about sharing, like, hey, go see this person. They may have a 6 month wait on their books, but they're worth it. Yeah.
They're worth it. Yeah,
Yes. Yes.
absolutely. Because that's one of the things that I praise about you when I've been referring your name out to people is
Oh.
the especially when it comes to weight loss. Because of course I live in Tampa area. I know you're in Polk
Mm-hmm.
County, but just like you said, because I trust you, because I feel like you
Hey.
are really about the people and really helping, is why I'm like, okay, I don't mind, even though we do a telemedicine kind of thing. But
Yes.
I still wouldn't mind driving to your office just because I trust you. There's a trust
Thank
factor
you.
there. And so you are so right. We need to share more about the people that we
Mm-hmm.
trust and that we know are about our best interests. And I think
Mm-hmm.
sometimes we tend to just, and this might even be culturally, we tend to hoard. Like we're like,
Yes.
nope, that's my doctor. That's my person.
Oh, it
I'm
is
not gonna
so
share
funny that
it.
you say
Yeah.
that.
Yes.
It is
And it's
very
not
funny. So
benefiting us.
it's not, it's funny that you say that. So I did just a brief presentation at a local church during breast cancer, so October. And
Hmm.
one of the points that I hit on is the fact that culturally we don't share anything about health. We don't know our mom's past medical history. Oftentimes, we don't know what our family is. We don't know this. We don't know that. We don't know, and that is going to be beneficial to screening, early screening for a lot of for breast cancers, prostate cancers, other things that we should. And this is why I tell people: if you have, excuse me, if you have certain histories within your family, you can get early screening covered by your insurance company. So,
Oh,
for example, if my mother, or I think even a sister, however closely related, if they have a history of breast cancer, then my insurance has to cover early screening and detection. But we have to know these things. We have to know
mm,
these things. Even some other conditions, if it runs within a particular like generation frame,
hmm,
insurance can cover it. But without the information, it doesn't have to be required to be covered by insurance. So as Black people, we need to share these things. It is so
yes.
important. Things that we don't know are resources to us that are actually affordable. Genetic testing. If I'm not mistaken, the last meeting I went to, Tampa General, if it was not covered by insurance, genetic testing was $250. And if something came of your genetic testing that showed like your mom or dad or a close relative, a gene was similar,
Hmm.
the person who's identified in that lineage that has that gene. Like I said, is if your mom can get
Right.
subsequent testing for free. And so that, yes, that I'm telling you, it becomes, and this is why we have to share information. This is the
Yes.
importance of conversations like this, because you're like, wait a minute, my mom was diagnosed with, breast cancer at 40. I'm 40, I'm 31. You mean to tell me I could get this covered for free, my testing? Yes, you can. Yes, but it's
I-
important to know these things. But my parents' generation doesn't share anything. They don't share anything about things like menstrual cycles. They don't share prostate history. These things that are,
yeah.
it's private, it's hush hush. I get it. It is your personal health. But what if a piece of information has the potential to prevent cancer exacerbate or just these devastating cancers in 2, 3 generations going forward? Like, we have
Yes.
power in the information that we hold. We got to share it. We have to get out of that habit of feeling everything has to be private and kept close to the chest. We need to share this information with our close loved ones. It's so, so important.
Yes, you absolutely. And I did not know that because my mom is a recovering from breast cancer, and her
Mm-hmm.
sister had the double, if I pronounce it right,
Mastectomy,
mastectomy, right?
really? Yes. Wow.
So, and then my cousin, who is the daughter of my aunt, she had also have it. So I'm one of those people that I have to go and
Yes.
get screened because it's so
Yes.
close. And I did
Yes.
not know that I could even do all that other testing, like you were saying,
Yes.
because again, it's not shared. Like nobody
It
shares
is.
this stuff.
Yes. So, and I tell people, if you have histories like this, mention it to your primary care provider. Should I do genetic testing? The answer should be yes. But should I do genetic testing? And because once these things, so genetic testing, once done, anything that's found becomes part of your medical record. It is now your permanent medical history, and insurance has to consider it. Yep.
Mm. Did you hear that,
It's
people?
not.
Y'all got to listen to this. This is going to be a podcast that you need to just keep share, share, share. This is so important information that you
Hmm.
probably would have never heard had Dr. Asia had got on here. Y'all need to make sure you are taking notes. Like take notes. Make sure you're getting this information. Make sure y'all reach out to her after this podcast as well. I'll have her information. We're gonna keep going, but make sure y'all are reaching
Absolutely.
out to her because obviously, like I said, she is so dedicated in this. She is so knowledgeable. I
Thank
couldn't have had a
you.
better person on here today to talk about
Thank
this, and I'm so
you.
glad we are talking about this and getting all this extra information.
Yeah,
This is
it's such
absolutely
a
like
passion
life
of
changing
mine.
for so many people. This
It,
really
it's
is.
such a passion of mine. And it's you see so many devastating neurological injuries and various things from traumas to, I could run the gamut of what I see in a day. And I was having a conversation with a client this morning, and she was just like, "How do you manage to do these things?" And I tell you, A, I love what I do. B, I feel like I bring a down home perspective and
Yes.
experience to the population that I care for at my hospital. But it allows me to be a support system. I see myself, although I work in medicine, my first goal is to be a support system and a resource. If I am not
Yes.
that, I am, and the theme of the day is real conversations. Um, Healthcare was a second career for me. And I know for a fact, without a doubt, God put me in this so that I can support not only my community, but I could be a resource and a help to others going through devastating situations. That is my calling. I have learned that. That is indeed my calling. So before I am the person who puts you on a breathing machine, puts a chest tube in you, puts you on dialysis, before I am all of that, you are a person I'm going to comfort and love on in some capacity, and we're going to figure this thing out together. And then after that, I'm going to put you on a ventilator. But I'm going to give you love, care,
Yes.
and then I'm going to support your family. I am going to be there because that indeed is my calling. Medicine is like the second phase of it, everything that comes with treating diagnoses, all pathologies, and all that thing. Yes, I'm going to do that, but I am going to care for you and your
Yes.
family and provide resources and point you in the right direction. That is my main goal. And so I
Yes.
absolutely love working in healthcare.
Absolutely. And you can tell just like I said, just by the passion, just how you're speaking about it, you can tell that this is something that yes, God has placed on you and that you are
Mhm.
truly sailing through this. You are flying through your calling at this point. And you've been elevated because this is elevation for you to
Yeah.
have, your business now. So that's elevation.
Yeah.
Like, and God is just opening up more doors, Asia, because you could just see it, girl. Like you need to be on somebody's panel somewhere to discuss this further. And I keep telling people this, like, everybody I'm bringing on this show for whatever reason, I mean,
Mm-hmm.
like, I pray about this before I invite anybody,
Mm.
because I want to make sure the people I'm bringing on here, again, this is about empowerment. This is about,
Yeah.
passing on information that is needed within the community. So I want to make sure everybody that comes on here is truly about that business. And you exude that. The
Thank
moment you
you.
start talking about healthcare, you are exuding everything that
Oh,
you are saying. You can see it. And I just
thank
love that.
you.
That's why I said, I trust you. I'm going to continue to share your information. I'm going to make sure, every time somebody asks me, oh, Dr. Asia Standifer, here you go.
Thank you.
She's located
That
here. You can even telemedicine her. She is
you
available.
can. That is a huge compliment. That is a huge compliment. And I it's funny that you say kind of how you prayed over this, you pray over who you bring on. And it's so important that we do um there's a spiritual aspect in healthcare, whatever you believe in, like
Yes.
whatever you believe in. But when I tell you it's funny that you say that because when I tell you I pray over what I do too. And my
Mhm.
prayer is even if people do not understand or believe in what I believe in, that if nothing else, when I walk in the room and I touch your hand, you feel something different.
Yeah.
What peace, calm, if you feel the love of God, whatever it is, I pray that you feel something different. Because no matter what area we work in, we all are going to interact with people. We're all going to affect people in one way or another. And so even with what you're doing, the fact that you say you pray over that because what you're disseminating information. Your
Hmm.
people are hearing this. They're driving to work, they're sitting at their desk, they're going through their own little trial and tribulation in life. And whoever you're bringing on, the topics you're bringing out and dispersing to people could be the thing that changes their perspective, their life. It drops something in their spirit. It gives them a resource. So what you're doing is phenomenal. It is phenomenal.
Yes.
You keep it up. And like you said, it's about empowerment. And what you're doing is you're giving voices to these topics that are going to affect change. So you keep it up. You keep it
Yes,
up.
ma'am. I appreciate it. I'm gonna keep
Mhm.
going as far as I can every day.
Yes.
So I'm gonna keep pushing it. You know what else we need to chit chat on? So I know we talked about we've talked about some of the things that block us, but let's also talk about some of the things that you offer at your practice in
Yeah.
particular, like some of the weight loss treatments, like some of the where you were talking about how now you can actually practice as a nurse practitioner,
Hmm.
offering some of those testings and things like that. So I know a lot of people have misconceptions about weight loss treatments. There's
Yes.
been a lot of stuff on the news, things like that. So I would like for you to just kind of touch on that, as far as like
Yeah.
how at your practice you're doing things as far as when it comes to weight loss and the treatments that you're offering and how those could benefit people and maybe dispel some of those misconceptions people have.
Awesome. So yes, so the big thing offering right now is weight loss medications, and so we all know the very popular ones that are out there are Wegovy, Ozempic, Manjaro, all those things. What's popular? They're popular because they're effective. Let's start there. And so with the right medical guidance, whether it's the retail versions or the generic compounded, they have been found to be safe. But what it does take is proper education, and this is what people may be seeing in the news. It takes proper education and being a responsible taker of these medications. So when we talk about side effects, be mindful of those. I'm very thorough in our consultations about how to mitigate the side effects. So it takes being just diligent about those things. The side effects are not major. They can easily be mitigated or treated. I think those healthcare providers, we also have to make sure we educate our clients properly about side effects and things like that. But overall, side effects are, I mean, so very minimal in the grand scheme of things as far as the percentage of people who experience them. I pride myself in being full service. Everyone has my business cell phone number. You can reach out to me and I can help resolve your problem. So I offer weight loss help. So we choose, injectable options, we go over nutritional things. There's a gamut of ways that we can assist losing weight, inclusive of getting labs done, making sure there are no thyroid issues, other endocrine disorders that are inhibiting your weight loss efforts. I also do some internal medicine. So cold, flu, urinary things, all those things we could do telemedicine or in office. We monitor, of course, blood pressure, vitals, and things like that. Uh, we do some of the fun stuff too, the IV hydration, that helps the
Mm-hmm.
immune system, some of the fat
Yes.
burning things. and just hydration overall. Little energy boosting never goes wrong with that. So we offer that, super affordable. What? Oh, vitamin injectables. Vitamin D. I tell you, vitamin D is an underrated. It's actually a hormone. We call them supplements, I think, out of pure ease, but it's actually a hormone. Vitamin D deficiency will have you feeling like a snail on a log going nowhere fast. And I'm telling you, when I am not staying on top of my vitamin D, I feel awful. And so I
Yes.
tell people all the time, when people are like, I'm tired, we need to check your vitamin D. I have
Yes.
people who have told me many times, because I do vitamin D injections in office as well. Super cheap, $15. Vitamin injectables are 15 bucks. And so they'll be like, Asia, that was life changing. I have heard the term life changing related to vitamin D more times. I would be rich if I took $1 for every time I heard it.
Yes. I'm
Every single
so glad
time.
you. Yes, I'm so glad you touched on that because that was something. Because I go to more of a what do they call them? My doctor is more of a natural medicine kind of doctor.
Yeah.
They do offer the prescriptions, of course, if you have high blood
Yes.
pressure that need to be controlled, but they tend to do more of like, the more natural as far as like,
Hmm.
so I did not understand that at first. So I'm so glad you brought that vitamin D because that
Yes.
was one of the main things she was drilling. She was like, you are vitamin D deficient, and I'm like,
Yes.
well, what is that? Like, what do you mean? And she's like, are you tired? Are you like sluggish? And I'm like, yeah, I'm like that a lot of times. It's like, yeah, that's your vitamin D. It's so much that goes into that we don't even know, like our hormones and just
Yes.
lacking those things that we don't even realize. That's what's causing some of the issues we have. So I'm so glad you touched on that because that is a real
Absolutely.
thing.
Absolutely. Oh my gosh. Yeah, a lot of people. And two, I've had people who thought they were in severe depression. Of course, life happens, but they were like, I can't get out of bed. I sleep for 8 hours and I still wake up and I'm tired. And it's just like, okay, I hear you. Let's do some labs first to make sure. And it was really the vitamin D deficiency. People underestimate the power of vitamins and the balance that it has, that homeostasis, that balance in your body of all your levels is super
mhm,
important because things can be off and you will feel like, I think I am really about to lose it because I don't even feel like myself. And it's just a simple imbalance that can be corrected.
absolutely. And I think it's a stigma around it too because I feel like people tend to just like write it off as something that maybe is like seasonal, or it's
Hmm.
something that's environmental, but they
They call it
don't,
seasonal
they never
affect
look at it.
disorder.
Yeah, they never look at it as maybe it is an internal thing. Maybe there's something going on. And I think a lot of people, like I know my husband's one of those big people that is just scared of needles. So,
Oh, I'll tell you this. I don't tend to brag about it, but I will since we're talking. I before becoming a nurse practitioner, I was a bedside nurse. I've worked critical care medicine my entire healthcare career. You'll be fine in my hands. I'll just say that. My skills are skilling. They're good. So
yes.
come see me if you are terrified of needles. I have so many people that are like, I didn't even feel that. And I'm like, yeah, I have a good technique. Send him my way, it'll be just fine.
Yes, because I'm like, you have to get like anytime if he had to go to the emergency room or something like that, like I have to
Oh,
literally like hold his
yeah.
hand. It is so hilarious. But I'm like, I know he's not the only one. That I've heard
No.
people say this before. Like, I'm not getting poked. Like, I'm not. I don't do
Mm-hmm.
needles. And I'm just like, you are so like missing out on something because you have to
Yes.
get these labs done. They're not gonna know
Mm-hmm.
just by looking at you. A lot of times, it's in your blood, and that's
It
where they're
is.
gonna get the information they need. And I'm just
Mm-hmm.
like, that's what, you have to come to grips with that. I'm like, is your life worth you
You
not
do.
getting poked?
Ooh. It
Like,
right, right. It is very important to make sure at least just once a year, at the very least just once a year, get your labs done so we can look at that very important things. And really just cholesterol, kidneys, liver, and maybe a few endocrine things. But at the bare minimum, let's look at some of those systems and just make sure everything looks good, especially cholesterol, especially cholesterol. When I tell
yeah,
you Black and brown people are at higher incidences of some of these cardiovascular or heart and brain incidences simply because we don't know our numbers. And
yeah,
that's it. And so if we can prevent some of these things early on, maybe you won't have a stroke, maybe you won't have that heart attack. We can catch these things and get them going and turned around early on. And that's important. That's the really important thing is early detection.
Absolutely. That is the biggest thing, like I said, and just getting that misconceptions out of your brain. Like people are so
Yes.
there's so many misconceptions, and it doesn't help now that before we didn't have the internet like we do now, and a lot of people tend to
Whew.
be their own doctors because they're gonna look stuff up on the internet, and they're like, oh well, I know what this and this is,
Child,
and
this
they'll
internet
choose.
is gonna take these people out.
Yes, and I'm just like everything cannot be on the internet. People, some stuff you need a professional. You need someone that
You
this is
do.
what they've gone and they studied, and not just the dude on TikTok that was talking about
Yes.
it. And I find so
Yes.
many people like, "Do you see that on TikTok?" And I'm like, "What on TikTok? Like, is he a licensed like professional, or is he just
Say it
somebody that just
again.
reads books?"
Right. And this is people love to say I did my research. And it's interesting because a Google search is not research. And I will say for those of like it took I was trained on how to research. It took 4 years for me to learn how to research, how to verify data, how to understand studies, how to understand what clinical relevance means to anecdotal relevance. Until you can tell me the significance of clinical significance of a p-value is, you can't tell me you did research. You look something up. There's a difference. There is a difference. Because baby, it took me this doctoral degree to understand research. However, there is something to be said about looking through things and trying to understand things. And so I don't take that away from anybody. I think it's very important to be your own advocate and to be prepared. So what you should use the internet for is to prepare your questions,
Yep,
not to diagnose yourself. Use the resources to prepare your questions, prepare for your visit, or after your visit. Okay, you get a prescription bottle, you're like, okay, I may not have had enough time at this visit with this doctor. Let me read about this. And then you prepare yourself to go back. You arm yourself with the information. The internet should be used as a resource. It should not be used to diagnose. And that's how I take it. Yeah.
absolutely,
Hmm.
absolutely. You hit that on the head. I cannot stress that enough. Please do not diagnose yourself. I mean,
Please
I'm one of
don't.
those people. I love to go read. I'm an
Yes.
avid reader. I like to research, but I'm still gonna go to the doctor. I'm not just gonna be like, okay, this
Yes.
is what I got. I'm gonna still go to the doctor.
Hmm.
It's like she said, there's nothing wrong with researching, but just please go to a
No.
medical professional. Like seek out
Hmm.
medical help. You don't want to be one of those
Yes.
people that was listening to the TikTok.
Yeah, don't listen to TikTok all the time. There are some good folks on TikTok. However, I will say, just leave it to the people who have trained and studied. And two, especially if you have a healthcare provider that you just trust, let them figure it out. Because sometimes it's a culmination of things, symptoms, presentations. Um,
Hmm.
that actually keys us into something else. And so it's nice to have, you could say, hey, I'm experiencing this, that, and the other. I looked a few things up. I'm thinking it may be this, but you in that conversation, you say one more thing, and that provider will say, I know what this is. So conversations are healthy. Definitely arm
Absolutely,
yourself with information, but definitely have that conversation with a licensed healthcare professional.
absolutely. So, just to kind of segue a little bit, what is next for Dr. Asia Standifer?
Oh man. Um, that's a good, scary question. Um, Continuing to grow Polk Concierge Medical. I am
Hmm.
adding in the first quarter of the year, I'm adding a men's health component to Polk Concierge Medical. That is a underserved population of people here, specifically in the areas of testosterone replacement, some other men's health things. Men, especially Black males, don't seek out care the way that they should. So I want to help serve that population while also addressing some other issues, and two, just access to care. There are a lot of people who want testosterone replacement for one reason or another. There's not a ton in the area, so to provide that service. Additional research. I was just presented with a research opportunity from a local physician, and specifically in the areas of um, end of life care, goals of
Mm,
care. How do we culturally address some of these things?
yeah,
How as healthcare providers can we be more effective and in having these conversations with particular populations of people? So,
yeah,
and then finding a way to do that and implement at a local hospital. So I'm excited about that. Yeah.
yes, and we are excited too. I'm loving that you're touching on these subjects that are kind of tabooish, right? Because we're not
Yes.
really we're not getting into them like we should. And I love that you're going to be bringing more focus on men, especially the
Hmm.
African American men, to your practice, because like we know they tend to suffer with the, especially with prostate cancer. You know, is one of the biggest
Prostate
things,
cancer. Oh my gosh. One of
biggest
the
thing.
slowest growing cancers Black men die from at alarming rates when it shouldn't
Hmm.
happen. And
Yes,
it's a lab test. It's a PSA. It starts with a PSA. You could literally come into my office and do a PSA testing for $20. $20 PSA testing to know your numbers and your levels. That's one of my biggest gripes, like with my Black men. My Black men, we got to do better, but I'm going to be providing those services so I can help address some of those things.
absolutely, absolutely. Like you said, and it's just that simple test. And I think, like you said, it's
Yes.
misconceptions too with that one. It's misconceptions. It's cultural things about that they don't
Yes.
like, and it
Yes.
stops them from going and getting the right testing that they need. But even like you said, $20 for the PSA one that you're offering at your office can
Yes.
literally tell them whether or not they're even on that path of having prostate cancer.
Exactly.
So people, there are so many resources here. Please take your time to learn this information and to really seek out what you need. There's no need
Yes.
in you like causing the stress on your families because the
Right.
lack of information or the misconception of what you
Hmm.
think might happen. You know, just you need to be able to ask. You need to reach out. So I'm so
Absolutely.
happy that you came on here today. I
Yes.
cannot stress
Oh,
that
an awesome
enough. The
conversation.
information that you have given has been life changing. I'm sure you've
Thank
heard that
you.
a couple of times now, but it has been so life changing. I know me. I need to go ahead and book an appointment to come see you about some lab work, and I'm definitely gonna get my husband in there since
Yes,
you are good
I
at
am.
needles.
I must say, I am pretty good. I am pretty good. I have developed these techniques over the past decade, and I'm pretty good. I'm pretty good.
Yes, I need to get him in there then because I when I say that 6 foot, 300 pound person,
I understand. I
person to the
understand when I
fix,
say I
baby.
see it all the time. And I listen, he can come and I will be very patient and he will be just fine. He'll be fine.
Absolutely. I so appreciate it. Dr. Asia Standifer, it has been a
Thank
pleasure
you.
having you on today with
Thank
your
you.
practice Polk medical concierge, just sharing all your information, your expertise. We definitely are going to put all your information in the
Thank
podcast, put
you.
it all over our social media. Make sure we're sharing it. If anybody has questions, please make sure you reach out with the
Yes,
information I'm going to provide from the podcast to schedule appointments with her. Again, she is also telemedicine. So please don't feel like if you don't live in the state of Florida, she cannot help you. You can reach out to her and she can do telemedicine appointments with you as well. So please keep
absolutely.
that in mind. She is not just strictly here to Florida, she can service you in other areas. Okay.
Hmm.
So again, we are going to go ahead and close this out. Please be good to each other. We love you, love on each other, and we'll see you.